So let's start. One of the first medications a lot of folks are on is a medication that you'll see it on your calendar as Lupron. Actually, we tend to order the generic version, save a little bit of money, and the generic version is leuprolide acetate. So don't be nervous if you see something a little bit different than what your calendar says. Also, when you get the leuprolide acetate delivered to you, often you get it in a little box that says 2-week kit or 14-day kit or something like that. We dose it out differently. Don't worry about that. If you find your calendar says you're on Lupron for 3 weeks, this is all you're going to need is this one little box. Okay. In IVF, in one fashion or another, you're always doing one thing in particular, and that is you're always turning off your pituitary hormones. We want to be in total control of this cycle. I don't want your pituitary trying to bust out and grow its own follicles. I don't want you to ovulate anything we're growing for you. So in one fashion or another, you're always on a medication that's going to keep your pituitary hormones quiet. And Lupron is an example of a medication like that. Now, this is a multi-dose vial. When you get your little Lupron kit, you get a box with the actual vial of medication in it. Usually you'll get a bunch of syringes, get some alcohol swabs, but this is what is called a multi-dose vial. That means this is all I need is this little guy. If I'm on this for 1 week or I'm on it for 3 weeks, this is all I need. Usually looks like it's about half empty, but you're real small doses, so this is going to be all that you need. Now, when I say it's multi-dose, it comes with usually a little plastic cap or what have you, or sometimes it's a peeled foil thing, and that just comes right off. And this guy just lives with a little rubber stopper just like this. Now, a lot of folks are going to start to ask about, as soon as I start talking about opening medications, they're going to start asking about refrigerating medications. The truth is there's always two answers, you do and you don't, and usually you'll get both those answers when you ask a variety of different people. Here's what's good to know. It doesn't hurt to refrigerate medications. With the exception of any of your oil products like progesterone and oil and estrogen, those are oil products. Don't want to refrigerate those because the oil gets thicker. Anything else, it doesn't hurt to refrigerate. And I kind of always live by the what I call the Mayonnaise Rule, which is when you get this stuff, if it hasn't been opened, really doesn't have to be refrigerated. A lot of it is going to be reconstituted anyway. But once you open it up, you're safe to go ahead and refrigerate it. And if you find you have to travel with your medications when they're supposed to be refrigerated, again, don't stress about that. We're talking about using little insulated lunch bags, an ice pack. I just don't want things to get real warm. But certainly I'm not so worried that it has to be kept at, 38 degrees or what have you. All right, so Lupron. Multi-dose vial. This is usually an injection you're doing every morning. It'll tell you on your calendar in the AM. Don't want that to be a stress point for you either. These are done every morning, and I always tell folks to kind of treat it like breakfast. You do it every morning, but it might not always be at the same time, and that's okay. Don't think you have to do these every morning at 7:30. Maybe Monday through Friday, 7:30 is good, but maybe you sleep in on the weekends a little bit and it's more like 9 o'clock. That's okay. Just keep it in the morning. Don't stress about doing it at the exact same time. Now, I mentioned that these will come with actually there are a bunch of little insulin syringes, and this is what we're going to use to inject our Lupron. Now, of course, anytime I'm going to put a needle through this rubber stopper, one of the things I'm always going to do is I'm going to open up an alcohol swab, and I'm always going to clean the top of that. Got to keep things clean. That's ready to go. I've cleaned the top of that. Now, this little insulin syringe is broken down into units. You'll see when you're looking at your little syringe here. It'll be broken down 5, 10, 15, 20. You'll see it right down the side there. Take a look at your calendar. Does your calendar tell you you're on 10 units? Maybe your calendar says you're on 5 units. Either way, when you push up and down, just up and down on this little plunger, you can see right there, that top of that black rubber stopper there moves up and down as well. And that's how you're going to decide how much medication you're taking out. So we'll go ahead and I'll give you an example how we're going to draw this out. We'll clean up, like I said, clean the top of our rubber stopper. Give that a little wipe. Uncap. Now this is as scary as most of your injections are going to be. Can you even see that? That's a little tiny needle. These are little subcutaneous injections. 90% of your injections are just going to be like this. And I'm going to demonstrate in a minute how we're going to do that. But first, all right, so I've cleaned my Lupron. I can put that right in there, just right in it goes. Now, of course, that needle's not going to reach that medication. You always have to do this little trick. Turn it upside down. You can see your needle in the medication there. And one way or the other, you can do it a couple of different ways. Let go, it'll stay right there. But just pull down on this plunger until you get to whatever your dose is. Now, you can always pull out further and push back in and all that kind of thing to fine tune it and take it right. In this case, maybe there's 10 units right there. Good enough. or maybe my dose is only 5 units, right? They're just a small amount. And there, I've drawn it out, put that away, put that back in my fridge. Now I'm just going to recap this guy because I got to get the spot ready where I'm going to do it next. So we'll recap that, keep that clean, set that down, and next I'm going to show you how we're going to do a subcutaneous injection.